Let's picture something for a second. A female T-Rex wearing a numbered t-shirt, a crying doctor bathed in sunlight, and a red carpet scattered with seashells? I know, it sounds literally like a bizarre fever dream, doesn't it? But what if I told you these random, surreal images are actually the master keys to unlocking the medical secrets of a highly complex autoimmune disease?
Welcome to this explainer. Today, we're going to dive into a seriously fascinating technique for mastering clinical details. Look, if you've ever faced the absolute mountain of rote memorization required in medicine or advanced sciences, you know the struggle is real. Today, we're tackling systemic lupus erythematosus, commonly known as SLE. But instead of just staring at a soul-crushing list of symptoms and genetic markers in a textbook, we're using a visual mnemonic canvas. It's a total game changer. By mapping hard medical facts to unforgettable, sometimes absurd images, we can basically hardwire this complex info into our brains forever. Here's our game plan. First, the SLE memory canvas. 2. Origins and genetic triggers. 3. Systemic signs and antibodies. 4. Cutaneous lupus presentations. And finally, 5. Joints and lab findings.
Section 1. The SLE memory canvas, visualizing disease. So why do we use visual storytelling? Well, it's because our brains are naturally hardwired to remember weird, unusual narratives way better than isolated plain text. Okay, let's jump right in. We're looking at a massive, interconnected pictogram. Think of it as a medical memory palace. Every single strange detail you see here maps perfectly to a concrete clinical fact about SLE. As we tour this gallery together, you'll see abstract concepts like specific genetics and antibodies transform into tangible, unforgettable characters and objects.
Moving on to Section 2, Origins and Genetic Triggers, setting the stage. Let's find out how this disease actually begins and who it primarily affects.
All right, picture our very first visual anchor. It's a woman smoking, holding an injection, just standing all alone on a small island. Super weird scene, right? But this one image is absolutely loaded with etiology data. The small island, that represents the Epstein-Barr virus. The injection she's holding represents hormone replacement therapy, or HRT. The cigarette obviously stands for smoking as a risk factor. And the fact that our character is female, that perfectly locks in the fact that SLE has a much higher prevalence in females than in males. So boom, in one snapshot, you've got 4 critical clinical triggers memorized.
Now let's talk genetics. How do we memorize complex genes? Well, with a dinosaur, naturally. But first, picture the flag of Iraq. But imagine it has 5 big X's drawn on it. This represents the Iraq gene on the X chromosome. And those 5 X's? That's your visual hook reminding you that more X chromosomes mean a higher risk for developing SLE. Okay, next up, imagine a female T-Rex rocking a t-shirt with a massive number 3 printed on it. This completely absurd image represents the TREX gene, located on chromosome 3. You are for sure never going to look at a T-Rex the same way again.
Section 3, Systemic Signs and Antibodies, the core features. We know how it starts, so let's look at what it actually does to the body. Let's shift over to another part of our canvas. Take a really good look at this next character. It's a thin, malnourished-looking lady. She's got a thermometer sitting in her mouth, and she's resting one of her hands on her knee. Take a second to really cement that specific image in your mind.
So, what's the secret code here? Well, it translates directly to the core clinical features of SLE. Her thin, malnourished look instantly cues weight loss. That thermometer, a universal symbol for fever. And the hand resting painfully on her knee, that locks in arthritis. So that's 3 major systemic symptoms perfectly captured by one character.
Now, right next to her in our gallery is a literal oversized sculpture of DNA. When you're dealing with SLE clinically, you're going to be hunting for the anti-dsDNA antibody to confirm your diagnosis. To make sure you never, ever forget this vital marker, just picture that massive DNA sculpture sitting right there. Simple, but incredibly effective for gluing that lab requirement into your memory. Next up, Section 4, Cutaneous Lupus Presentations, a tale of 3 rashes. Get ready for 3 totally distinct, unforgettable scenes mapping to specific skin presentations.
We're going to contrast 2 fascinating characters here. On one hand, we've got the innocence of a small girl with a butterfly on her nose. On the other, a highly stressed, crying doctor wearing a starry badge. These 2 very different emotional vibes represent the acute and subacute cutaneous forms of lupus.
Let's decode the acute cutaneous presentation first. Picture that small girl. There's a light red, winged butterfly sitting right on her nose. She's showing her fist, her mouth is open, showing ulcers, and a ray of sunlight is falling directly on her. Let's break it down. That butterfly isn't just cute, it's the classic Mahler rash. She's showing her fist to firmly remind us that the knuckles are entirely spared from the rash. The open mouth points right to oral ulcers. Because she's a young girl, we naturally remember this is more common in a younger age demographic. And that sun ray, it means the condition is highly photosensitive.
Now for subacute cutaneous LE. Our symbol here is a crying, white female doctor with a 3-star badge on her pocket, and she's also standing in a sun ray. What are the clues? Well, she's white, which tells us this presentation is most common in the white population. See that 3-star badge? That's your genius hook for the HLA-DR3 marker. The fact that she's crying associates perfectly with being anti-Rho positive. And just like the little girl, the sunlight means this presentation is also photosensitive. You just unpacked 4 complex clinical facts from one stressed-out doctor. Finally, for the chronic cutaneous presentation, we're taking a walk down a very weird red carpet. This carpet has designs of discs and clouds. Scattered on it are seashells and a single cork. So the red carpet represents the carpet track sign. Think about how completely random a cork is on a red carpet. That oddity makes the follicle plug impossible to forget. The disc designs naturally stand for the discoid rash, the seashells cleverly represent scales, and the overall image helps us lock in that this presentation causes scarring lesions.
Section 5, Joints and Lab Findings, the final clues. We are in the absolute final stretch here, looking at severe joint complications and lab diagnostics. Over in the corner of our canvas, there's a really striking image, a woman with noticeably distorted arms and legs. Now, earlier we saw a lady resting her hand gently on her knee for general arthritis, but this jarring visual of distorted limbs maps directly to deforming arthritis. It's a crucial clinical distinction. We're moving from clever mnemonics to a very serious medical outcome, and this severe visual makes sure you recognize the clinical gravity of deforming arthritis. And for our absolute last clue, we hit the lab. Imagine a tiny toy house just completely packed to the brim with green sand. When you're conducting an immunofluorescence or IF investigation, this image is your reminder to look for the houseful pattern. I know, it sounds totally wild, but trust me, when you look under that microscope, you'll be so glad you pictured this weird little toy house. It is the ultimate visual trigger for the houseful pattern on the IF investigation.
We've taken a massive amount of complex clinical data about SLE today and hung it entirely on visual hooks. From a woman smoking on an island to a crying doctor in the sun. It really proves that learning doesn't have to be a brutal battle against a wall of text. It could be a vibrant, engaging explainer of a canvas. So I'll leave you with this. If a T-Rex and a toy house can literally decode the intricacies of an autoimmune disease, what else could visual memory unlock for you in your studies? Keep visualizing, keep connecting the dots, and keep learning.